Our last three bills. No. We might do.
No, we did all the fine.
You want to do the pledge first or no?
Yep. Good morning and welcome. I'm going to ask Senator Avard to lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Do you need a motion to move into exec?
Motion to move into exec.
So moved.
Second. All those in favor say aye.
Aye.
Opposed? All right, we've got 3 Senate bills left hanging here, and 2 out of the 3 are mine.
That ain't bad.
So let's start with. I got it. Let's start with Senate Bill 647. And I'm going to move on to pass just so we can have a discussion on this. And I've got a second. So 647, as you recall, this would pave the way for state-sponsored prescription drug discount programs. We are working. I've been speaking with Department of Insurance on this. I had a call with the governor's office just talking about, if legislation is needed or not, or if this can be done through the executive branch. I'm going to ask the committee to pass this. There does need some more work to be done on this. The work is ongoing, and hopefully we'll have something here shortly. So
In my notes, Mr. Chairman, I noticed that on line 2, I had a question about, is this too broad? Cooperative procurement groups via intergovernmental agreements. That line a little bit too broad.
it's too broad. It is broad, and it doesn't necessarily. We don't necessarily know if we need legislation to do this. There are, as we talk about prescription drug discount cards, there's like 40, I think, that are operating in the state of New Hampshire. All are a little different than what we're trying to do here. There are these new discount programs that they're called state-sponsored discount programs, and they would work just like any other discount card that you would use in a pharmacy. The difference being these are have much tighter controls on privacy. They're more transparent. The people know where the money is going, and we're being told because they're transparent and understanding where rebates go, there can actually be a greater savings to consumers than the traditional discount cards that we have available to us now. The question is, these are called quote unquote, government sponsored. We're working on what does that mean? That I don't want anything that the state would have to pay for, and that's not what this is. But the state, because of the way these different types of programs work, the state, as I understand it, just has to give the okay to let them come into the state and operate. The state of Vermont just did one of these programs 3 weeks ago. It's up and running. The state of Connecticut did it, as we heard in testimony. The state of Oregon, Washington, I think Arizona is doing this, but we're not necessarily totally clear on which. And the problem that we have is the way those were done in other states, they have departments and procedures in those states that New Hampshire doesn't have. So I spoke with the New Futures on this. They understand that. I've spoken with the Department of Insurance on this. They're working through some of the questions on that. And what I would ask is we send this out of committee, give them a little more time to work on, and we may not even need legislation to do this. As I said, I've spoken to the corner office. They're researching that. We may not even need this. So I would ask, just for the sake of keeping things moving, to pass this out and give us a little more time to work on it.
And this just covers everybody, and I know in testimony it said regardless of anybody's immigration status. That was what testimony.
Yeah, I think that's right, because this isn't a government program. This isn't a government money. This isn't, this isn't like a Medicaid money that's going into this. This, you see a lot of these programs, you go into the doctor's office and there's a display of any kind of discount program. They're not, as far as I know, they're not prohibited by immigration status to get a discount on their prescriptions. It's not a Medicaid program. It's not the government subsidizing private insurance. It's, the manufacturers agree to give these discounts, and who gets them is whoever has that card.
Right. And one other question that I did ask during the committee was, how is it funded?
And again, it's funded through, the way these discount programs work is so you get the discount operator, and then manufacturers will agree to participate in this. And when I say when manufacturers agree to participate in this, manufacturers will agree to discount their products, their drugs, and a little fee is taken out of that discount to go towards the administration of the program.
So I have a question. How long are you planning on working on this? Are you going to have something ready for when it comes to the floor, or are you going to?
I'm hoping we'll have something ready coming to the floor.
Okay.
And the insurance company is not involved in this in any way?
No, we didn't hear any testimony. It doesn't affect, as far as I understand, it doesn't affect them at all, because it's not an insurance product. And that's where the Department of Insurance is, they use PBMs to administer the program. That's who that middle person is. So there is some connection to DOI with that, but they don't administer discount program cards. They don't have oversight. So we're trying to find some language. And DOI has called me and they're like, we just don't have time to, if you can give us a little more time, we'll do that.
So if we pass this, how do we get to work on it?
So it gives another week for the
I
parties.
just asked that question.
It gives them another week for
I know.
all
Just
parties.
referring in my head what you said, what you asked.
Yeah, so it will give them another week. It'll give them another week for the Department of Insurance to work with the stakeholders. Give them a little more time.
Okay. All right.
Give me a suck, help me out, please.
Throw me a bone.
Throw me a bone.
We're with you.
All right,
I'm with you.
so we'll go buy them a week and we'll go from there.
So our vote basically buys them a week.
Yes.
All right.
All right. So all those in favor of the ought to pass motion on Senate Bill 647, say aye.
Aye.
Any opposed? I am going to leave this off of consent, and I will take it out. All right. So let's go to Senate Bill 456.
456.
I'll move ought to pass.
456.
456.
And I see there's an amendment, and I had a real problem with 17 members appointed by the governor. I'm not sure the governor would appreciate that either.
I don't have 456. I don't have 456.
It should be, oh,
Are you talking amendment 456?
No.
The bill
Bill
456.
456.
The reason I do not have 456.
Is it one of those on the desk over there?
Nope. 504, 613, 647. I have the amendment. I just don't have the bill.
This is establishing the Commission for Children's Futures.
Yep. No, I don't have it. All right. No worries.
Did I get a second on my ought to pass?
Second.
motion? All right. And then I'm going to move amendment 2026-1174 as.
Second for discussion.
All right. So this amendment, Senator Sullivan introduced the bill the other day, and she did come speak to me afterwards. She said she spoke with folks in the department in the hallway. I relayed some of our thoughts on this, and the thought that I had was more the teachers, one of which had to be certified in special ed. The number of members was not one that we discussed, but I did talk to her about the fact that, teachers were on this, and the goal of the bill was to get folks involved, particularly in like IEPs and things like that. We wanted to make sure that we had somebody certified in special ed. So I'm up for, we can discuss that and anything else in the amendment.
In the original bill, it does say 17 members,
It
right?
does.
And so this amendment, basically, there were holistic medicine, blah, 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 blah. So it just adds to the holistic medicine area?
It was in the original bill too. Is this a duplication of, I thought, I wasn't here for the hearing.
Yeah, so there was comment from the department, said there are current commissions entitled Oversight on Children's Services, Children's System of Care, Shawship, and the 737 Commission. All of them kind of touch this area, but none of them do
Okay.
the umbrella that this bill is trying to get at.
Okay.
Thank you, Michelle.
Oh, IEPs. Yeah, actually, this might be one, because I had a conversation last fall with the dairy superintendent and a couple of teachers, and they're having real problems with IEPs, and some of the advocates coming in. So this may be able to, we might be able to touch on some of that.
What kind of problems with the IEPs?
Or not problems with the IEPs, but it's more issues with the advocates that are coming in. But I can talk to you about that offline. Yeah, I think where it says Commission shall study the usage of individualized education programs in schools and trends within IEPs over time. I think that the issue that the dairy superintendent and the teachers have might actually be covered in this. So this, I will support this.
And you had some concern or some interest in the number of members, 17.
It's in the original bill.
Yeah.
So I just find the governor appointing 17 members with all of this. But it was in the original bill, so we don't usually have the governor appoint that many people.
Now's the time to change it.
No.
All right, you're fine with it?
Well, who would, I mean, sorry, Chair. Chair.
Yeah, go ahead. Turn your microphone on.
To Senator Birdsall's point, and you just said now's the time to change it, so 17 is a big lift. I'm appreciative in the amendment that the special education piece, because that was something, I think I was one of the people that spoke to that, but is there, I mean, what's the alternative respectfully to the governor? Like, is there?
Well, usually what happens is, 17 members, and then we kind of choose,
Who those are?
a member, a healthcare professional is licensed in the state. Someone would be assigned to assign someone.
Mhm.
And I have a feeling that's probably what's going to happen anyway.
That certain like an organization would be named to appoint their designee. So the
Yeah.
legislation would list out the organizations or the topic areas
Correct.
and say the person, the department or the association, whoever it is that's responsible, they're the ones that would.
Right, like it would be like number one in the amendment, healthcare professionals licensed in the state. It would be the AMA or
It could be AMA.
Yep. And or the chair or their designee, who is healthcare professional licensed in the state.
So, procedural question, we have to get this out today, correct?
Yes.
All right. So I'll support the amendment in order to move this along, but
You might want to look at,
we might want to consider what we just talked about for the bill before this. There still needs to be some tightening and maybe a more efficient way to get people appointed. And that's not about a governor, it's just about the process. So.
Yeah. This is typically not the process that we use, but again, I'm okay with putting this forward.
Sure.
And work on it.
Any further discussion on the amendment?
I do.
Senator Long?
Thank you, Mr. Chair. So senators and state legislators, are they not on this? Or
They
is that-
are,
they-
yeah, that was a previous section that was not amended. So if you look up above, in the original bill, it's letter C, I believe.
Yeah, number 8.
Roman numeral 1,
Yeah.
letters A and B.
Yeah, it's not a
2 members of the House and 1 member of the
Oh,
Senate.
okay, great.
replacing this.
Well, 2 members,
Okay,
one from the Democratic Party, one from the Republican Party.
Who's supporting it?
What do you mean? Well, like the PTSD Commission is not attached to any agency. Hmm. Okay. I would imagine it would be HHS. John? Can we ask you a question?
Good morning. For the record, John Williams, the Legislative Director for HHS.
So, if we were to study the Commission for Children's Futures, RSA 200, would this fall under HHS?
I'm sorry, could you repeat the question again?
So, the study commission is called Study Commission for Children's Futures.
Mhm.
And it's amending RSA 200 by inserting the commission in there. And it's to study the health and well-being of children in the state and to identify gaps in mental and physical health services. So that would fall under HHS.
So to appropriately frame the issues, the RSA chapter that it is under is typically that under the Department of Education. So
Okay.
certainly they have a very strong interest in this. We as an agency, as you know, work collaboratively with the Department of Education on many issues, including behavioral health issues, which would be within the department's province. So notwithstanding the statutory placement, I think it would include both of our agencies. But if you're asking the question, which agency would report under the RSA 200 section, that would be the Department of Education. But we also have a strong interest in this as well.
Okay. Yep,
All right.
thank you.
We need to put that in there specifically.
Yep.
Any amendment or floor amendment?
Okay. So we've got the amendment to 1174. And it sounds like we want to make a committee amendment that would administratively attach this to the Department of Education. You good with that?
Yeah. You could vote on it and then do another committee amendment, or you can just withdraw and vote it as one thing.
I'll withdraw my motion.
Second.
So I move text in 1174 plus add as committee amendment to administratively attach it to the Department of Education.
Second.
Any further discussion on the amendment? All those in favor say aye.
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 Any opposed? So the motion is ought to pass as amended.
Moved.
All those in favor say aye.
Who seconds?
Oh, do we have a second? I'll second that. All those in favor say aye.
Aye.
Opposed? Senator Prentice, do you want this on consent? It sounded like you might want to work on this a little more, or do you want to leave it on consent? And
No, I think we need to work on it.
okay, we will not put that on consent.
I'll take it out.
Senator Prentice will take it out. She's got it right now. Yep. So we're gonna take up Senate Bill 504. Sophie has an amendment to that.
Did you want to do the amendment that you introduced up here as well, or just?
No, actually, this amendment that you've got should encompass that.
Oh. Do you have some stuff here?
So I'll move on to pass on Senate Bill 504.
Second.
Senator Birdsell seconds that. And I'm going to move amendment 2026-1222S. And I'm going to speak to my amendment. I think that we had a significant amount of support at our hearing last week on this bill, and including the Department of Health and Human Services, which made the rare vote of confidence in supporting this because it fits in well with the rural health transformation. We did hear some concerns from the Medical Society. I've met with the Medical Society. I took some of their concerns and incorporated it into this amendment, and I can speak to that in a minute. But one of the things that we did that I think would settle some of the concerns, the one concern that we brought out is we're adding the word prescribe in the definition of pharmacy. And as we heard that the pharmacists, whether they do it or not, that word is in the Pharmacy Practice Acts of like 30 states, over 30 states. But one of the things that personally I wanted to do, even though this is my bill, is put some guidelines around that and guardrails around that. And we incorporated, if you look on page 1 of the amendment, lines 3 through 6, it specifically defines a scope of practice, and the scope of practice based on education, training, and experience, and determined by practice setting. I felt that this really doesn't take the it puts guardrails on, so we're not having pharmacists do things outside of their scope of experience and training. And as we heard, that experience and training that we're seeing right now in graduates of our own pharmacy school in New Hampshire are very in-depth and very comprehensive and take into account diagnostic criteria and prescribing guidelines. So we want to make sure we define scope of practice. That's one of the things that we added in there. The other thing in there is page 1, letter B, which essentially says they can't do anything outside of the scope of practice. So we define a scope of practice and we say they can't do anything outside of the scope of practice. And then that last sentence says pharmacists may perform any act not prohibited by federal or state law. So that gives the ability for some more guardrails to be put in. And we do have a lot of guardrails as it is. And it has to be, anything they do has to be consistent with their education, training, experience, and clinical competence. So that's clarified. The other thing that I took from the Medical Society is on page 2, lines 1 through 3. Nothing in this paragraph may be interpreted to permit an alteration of a prescribing clinician's directions, diagnosis, or treatment of any disease, the initiation of any drug therapy or practice of medicine. So really, what I wanted to do, capture with this, and I thought the Medical Society was excellent in bringing this up because, I agree with them, is we don't want pharmacists to be used as a second opinion for a physician. So they go to a physician, they don't like what they hear, they can go to a pharmacist and have them change that. That's not the goal of this. The goal is to, look at some of our primary care deserts, particularly in our rural areas, and is there anything that we can do to bridge that gap? That I think we can protect any extension of scope through this line right here, in that, there's a therapy started by an MD. You can't go to your local pharmacist and have that changed. And that's, I think that puts some guardrails in that. The testing on the jurisprudence exam, the amendment that I talked about, was incorporated in this amendment. And then lastly, again, with the Medical Society's guidance, the liability and negligence, saying essentially in clarifying that, and I think it probably is in other parts of the law, but we want to be very, very clear that if a pharmacist is expanding the scope of practice, they are legally responsible for anything that happens with that. Makes it very clear. So that's the amendment, and I'm open to any discussion on that.
Second.
Seeing no further discussion, we'll call a vote on Amendment 1222S. All those in favor say aye.
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 Opposed?
Move on to pass as amended.
Dr. Pat says amended. We have a second. All those in favor say aye.
Aye.
Opposed? I'll move consent.
Consent.
Second. All those in favor say aye.
Aye.
Opposed? And I'll take that out, so. And right on time here. By a motion to, unless there's anything else we want to talk in executive session,
Motion to
I'll
move
take
out
a
of
motion. All right. I know, he's on the ball. All those in favor say aye.
Aye.
Opposed? All right.
That's going to give you a hard time.
I know. I'm- All right, with that, we're going to open our next hearing. I think we're on time. Yes, we're right on time. Senate Bill 232 relative to the rights of conscience for medical professions. We'll open the hearing and ask Representative Pearson to introduce his bill. Here he is.
Thank you, Mr. Chairman and members of the committee. My name is Mark Pearson. I represent 3 towns in south central Rockingham County. I'm also chairman for 6 years now of the DHHS Oversight Committee and of the New Hampshire Commission for the Deaf and Hard of Hearing. I'm the lead legislator in the House on the endeavor to expand significantly our mental health court, and I'm the prime sponsor of the bill before you. I grew up a moderate Democrat in Massachusetts in a mill town in the 1950s and 60s. One of the emphases of our party at the time was freedom of conscience. We were told much about the failed uprising against communism in the country of Hungary in 1956. We were told much about the punishments meted out to German doctors who refused to participate in cruel experiments on unwilling patients. Well, as for the Republicans in our town, they were mostly farmers and blue-collar workers and had to be very busy dealing with their own issues and not the issues we were talking about. They were just trying to get by. Or else our Republicans were company owners at the country club for whom the rights of conscience were deemed hazards to their profit margins, or so we believed. No, I grew up believing in freedom of conscience. This bill addresses one item only and one profession only, and this is done intentionally. In my 10 years in the House, I've seen far too many bills laden down with all kinds of topics. I think the record was 86 at one point. I came to appreciate and vowed to craft bills that simply address one thing. Others who wish to address rights of conscience on other matters and for other professions, of course, may file their own bill. New Hampshire is but one of 3 states that does not protect healthcare providers for reasons of conscience regarding abortion. New York and Massachusetts both have such protections, and they have no exceptions for emergency procedures that this bill allows. Even some states, such as California and New York, even have penalties in their laws for violations. Maybe they've remembered their Democrat roots on conscience. Having said that, this is not an abortion bill. No changes are made to the availability of abortion. If a physician exercises the right of refusal, he or she simply gets out of the way and lets someone else do that procedure. It is not an abortion bill, it is a conscience bill. We also made sure that we put some limits in the bill at the suggestion of members of the House committee that previously heard this bill. Those employed at a facility where abortion is practiced but do not take part in the abortion are not covered here, such as the janitor, the billing clerk, the front desk person, other similar people. And if you are against abortion and go to work at a facility where a good portion of the work is abortion, this bill does not protect you, nor, in my opinion, should it. It does not allow you to go get a job at Planned Parenthood so you can gummy up their works. This bill does not apply to a healthcare provider who's the only healthcare provider present in an emergency situation. Now, some people might say this is a solution in search of a problem. My wife is a family practice physician. She advises young women newly licensed as physicians in New Hampshire. And through her, I met a young woman that she was monitoring who'd been fired for exercising her conscience in the facility at which she worked. Her saying no did not prevent an abortion. Others of the physicians could step in. In fact, one did. It was about the facility choosing to dishonor her for her beliefs. Some may say it was mean-spirited. We know of other situations like her. This is a problem, in my opinion, that needs a solution. And finally, we need more medical people in New Hampshire, especially OBGYNs. Passing this bill would not keep those who would practice abortion out of our state. They'll still come. But not passing the bill would keep those who do not wish to practice abortion from coming here. How do we know that? We've asked around. So please pass this bill. And I would encourage you, let's honor conscience, irrespective of political party. Thank you, Mr. Chairman and members of the committee.
Thank you very much, Representative. Any questions? Senator Long, I got you first.
Thank you, Mr. Chairman. Good to see you again, Representative. Are you aware of federal protections already in place for conscience?
Yes, I am, and yet we still have this problem existing here. Sometimes federal protections don't always get to the ground level. I'm suggesting that protections be, duplicated here.
Very good. Follow up for me?
Yes.
With respect to, you gave an example of somebody who had been terminated for objecting. And you said there were a few more. I'd be interested in those. The fact that in New Hampshire that is happening now.
I will ask my wife over dinner tonight, the particular person, before I went on to cite a few others more broadly, wished not to file a lawsuit. People were encouraging her to, using those federal statutes you suggested. She chose to go elsewhere, but it did really upset her.
Very good. Thank you.
Senator Prentice, did you have a question?
Yes, I did. Thank you, Chair Rochford. And good to see you, Representative Pearson. And Senator Long started down my line of questioning, but he got to it a little bit first. I'm looking for where the groundswell is, or where the, examples of how this is a problem in New Hampshire. Respectfully, I thank your wife for working in the medical profession and continue to provide access to health care, but where is this a problem?
If I understand the question, the problem is for that one individual whom I have met, a few others that were cited along the way and Senator Long, yes, I'll see what I can do to get more info on that. And the fact that New Hampshire is only one of 3 states that doesn't have anything specifically in our laws. But I also know from being 10 years in the House that if a couple of people are having their rights violated, we still want to help. I've heard this is not a groundswell on many occasions, and I've never supported that, even if it was an issue that wasn't my issue. A couple are too many.
I'll wait for my next question.
All right,
It's not
Senator
direct- it's
Birdsall.
not direct follow.
Thank you for taking my question. The individual who used her right of conscience, you said she moved on. Where did she go?
I believe she went to Wisconsin. She had to take some time off to regroup personally, but she landed in a state where there's on the books some pretty good protection. That's where she went.
So what you're saying is we lost a healthcare provider.
That is what we could say, yes.
Thank you.
Any further questions from the committee? Senator Prentice.
Thank you, Chair Rochford, and thank you again, Representative Pearson. So you mentioned this in your opening, but I'm still struggling with it. You say that I'm not going to put words in your mouth. I'm concerned that this language is broad sweeping from a scheduling assistant or a receptionist right through to a care provider, the way that the bill is written, but you say that it's not. So help me to understand where this difference is, because that is something that keeps coming up, that this is, broad sweeping for anybody, whether they're providing care or not.
Trying to do this on the fly. Section 5. Okay, near the bottom under 126 EE2, Roman 2. I'd have to go back and reread this. It was certainly there last night.
It's okay. Whenever I'm under pressure to find something in the moment, it doesn't always happen for me. If you could follow up on that, that would be great. Thank you, Representative Pearson.
Can I?
Yep.
So would it be on the amended by the House, page 2, Roman numeral 5, healthcare provider means any individual who, as part of his or her employment, may be asked to participate in any way in an abortion, including but not limited to physician, and it lists all of them, or any person who furnishes or assists in the furnishing. That's pretty specific, I think.
Notice that it does not talk about janitors or front desk or billing clerks or the various other people who are there. It talks about people who are actively doing an abortion.
I'm going to follow up on that, Senator, but it does say on line 11, but not limited to. So, and, clearly, I know you said this is an abortion bill, but that's very clear that this has to do with abortion.
Mhm.
And it's not limited to, And then you go on saying a hospital or clinic employee. So let me ask you this. So if this passes and you've got a medical practice that physician is doing these procedures, and that's their prerogative to do that, but that hospital or clinic employee, let's say, is responsible for scheduling those procedures, and they have a conscientious objection to that procedure. And when they get the call, hey, I'd like to schedule it, I've got a conscientious objection, hang up. Or I'm sorry, the doctor's full. We don't. I'm trying to see if we're providing protection for somebody that may actually get in the way of care. And I use that, I'm not advocating, that procedure, but if you've got a physician that's choosing to do these procedures and now you've got someone blocking that, are we providing protections for somebody that may not have a role in the actual function of in participation and carrying out these procedures?
That's not the intent of the bill as I filed it, and that is why those categories of people are not mentioned in the bill. The ones actually doing the procedure are the ones who are mentioned.
But it says not limited to. So
Understood.
I understand that, and
Okay.
I get what you're saying, but that could, as well as I do, that could open a Pandora's box.
Yes, sir.
All right. Senator Abar.
Thank you, and thank you for your testimony. Representative, would it cause a lot of heartburn if we did strike the not limited to?
Not to me.
Thank you.
All right. Senator Long.
Thank you, Mr. Chairman. Actually, page 2, line 32. Institution that provides abortion has a major part of its services.
Mhm.
Is that defined? I mean, what is a major part of its services? It could be in my mind minor, but in somebody else's mind major. Should that be?
I was actually toying with 47.3% and thought that was not a good idea.
Okay.
That was a snarky answer, and I apologize.
No, I understand.
The point is, anybody who is anti-abortion wouldn't go to work for Planned Parenthood unless they were specifically getting on board so they could always do refusals and muck up the works and make things complicated and so on. This doesn't protect that bad-spirited action.
Okay, and quick follow-up on it?
Yes.
Thank you. The hiring process, I'm kind of thinking that the hiring process, if this passes, would be more specific on those that aren't doing abortions would ask if they're anti-abortion, and those doing services would ask if they're pro-abortion.
Well,
Would that be
as a
fair?
part-time chief executive of a small medical center who does the final interviews on hiring of staff, there are certain questions that I ask. In other words, I don't want to surprise you and I don't want you to surprise us. And I would certainly suspect a young physician seeking employment who is anti-abortion would bring up that subject and say, if you were to hire me and I came, would you make me do something against conscience, specifically this? I would expect somebody in the interview to bring it up. I might expect the prospective employer to bring it up. This is really the situation, was that it never came up in the interview in either direction. But when the person got there and started working, she said, oh, I cannot participate specifically in abortion, which is about 15%, 10% of what you do here. And it seemed for the time to be okay because there were several doctors on the staff. But then all of a sudden, she was assigned, and it seemed she was assigned specifically, intentionally, to go against her conscience when others on the staff could have stepped in and done it.
Very good. Thank you.
Yes, sir.
All right. Are there any other questions for Representative Pearson? Senator Prentice.
Thank you, Chair Rochford, and thank you again, Representative Pearson. Just following up on someone of Senator Long's question, because it says healthcare. You've said this is not an abortion bill, and then we swap over to healthcare institution, and that question that Senator Long asked you about, like, how much is, like, what makes, where is the line in the sand? And this is not just the way I read it, and help me out here, specific to, and you've named, say, Planned Parenthood, but there are other healthcare organizations that are providing these services. So where's the line in this?
It would be difficult because over what aggregate number of months? Is it in the last 3 months it was this much and the next 3 months it was down there? It would be difficult to put a line with a specific number attached. And I use Planned Parenthood as perhaps the most obvious example. But yes, of course, there are other facilities where a goodly percentage of what they do is abortions. I don't know how I would put a number.
I don't know how you would either, but the way the language is, it's just not, you pointed to one organization, there are multiple. There's some, many times in legislation, as you know, we try to be as specific as possible to avoid creating gray areas where people can find themselves in situations as you've described in others. So that has to really be seriously taken into consideration how that part of the language is defined if this were to move forward.
I would ask that there's probably more carve-outs and exceptions in this bill than a similar bill is in a number of states. And when I read some of the blue states' laws on this, I said, wow, that's more specific than I might want to do.
Thank you.
Any other questions from the committee? Seeing none, thank you very much. Representative Weber, I see you signed in and I see you're standing here. Do you want to speak or not? You didn't check, okay. You didn't check the speaking box, but I will check it for you. Yes.
I was just explaining it to somebody else and I neglected to do it myself. Good morning. For the record, my name is Lucy Weber. I represent Cheshire 5, which is the Connecticut river town of Walpole and Surrey. I'm here opposing the bill. I'm increasingly concerned about a trend I see, and this is only a tangential part of it, but I see particularly in the House, a trend that we pass a bill, we have a law, in this case, we have a law, and then we pass more laws for all the people who don't like the law that we have, and therefore we're kind of diluting the law as a broad category. I think I'm very concerned about the rights of conscience, but I think that the remedy in this case is a matter of with personal freedoms come personal responsibility. And if it is something that disturbs your conscience, you ought to be taking a different job with respect. I think that even as drafted with the guardrails that are put in, there's a significant amount of opportunity for the kind of gotcha behavior or disruptive behavior that will fall within this. The first thing that comes to mind is that language on line 32 about the care being a major part of what they do. The reproductive health care organizations that I know of in this state provide a vast array of reproductive health care, screenings, treatments, all kinds of things. And even for those that perform abortions, it's a minor part of what they do, not a major part. So this wouldn't cover them. And that concerns me enormously. The next thing that we haven't talked about are the civil penalties that are included here. There is a civil penalty of $10,000 every time you violate this, this statute. And one of the things that the statute requires is it has very specific posting requirements about what an institution must post about the rights of conscience. So if you don't post it right, you get a $10,000 fine. And then there is a very broad discussion on page 3, line 5 to 7, that says a healthcare institution shall ensure that every healthcare provider is informed of his or her right. And it seems to me that that is another thing where if all the I's are not dotted and all the paperwork is not appropriately signed or appropriately filed or appropriately documented, that there's a significant risk to the organization for what is a technical, in my opinion, a technical violation of this statute. So for all of these reasons, I think the statute has the potential to be, because I think the intent behind it is a very good one, but the potential is there for it to turn into a gotcha bill that gets abused. So for that reason, I hope you would find it ITL.
Thank you. Now, if I'm not mistaken, you're on HHS in the House.
That's
and, did you hear, I know we heard from the prime sponsor that there were people affected by this and then moved on. Did any of those folks come forth in testimony to the House?
The bill went to judiciary in the
It did.
House, so
All
I
right.
didn't hear it.
All right.
For some abortion, birth, death, and marriage go to the House
All right.
rather than to the judiciary rather than health.
Very good. Any other questions from the committee? Senator Birdsell.
Thank you. And thank you for taking my question. So when you first spoke, you said if that individual had didn't want to do those services, then she should have found another job. Why should she be on the hook to find another job when there were other doctors to replace and they required them to do that position?
I get that. But I guess I was speaking to the broader notion that I was raised with, was that in my life, I would have to make an awful lot of choices about what my conscience dictated that I should do or shouldn't do. And we already have federal protections. My understanding is that our institutions have policies about conscience. I certainly have heard testimony about that a number of times in the Health and Human Services Committee, although not with this bill. And so I think it is bad legislating to take 1, 2, 5, or 10 people who have had bad experiences, who had remedies that they did not seek to follow, and change the entire law based on a very small experience.
Follow up.
I hear what you're saying, but I'm also concerned about the fact that that institution violated federal law and basically got away with it.
I quite understand that, and I think that that is absolutely wrong, but if I heard the testimony correctly, because I know nothing of that situation, I thought I heard Representative Pearson say that that person was encouraged to take action and chose not to do so.
Thank you.
Any further discussion or questions from the committee? Thank you very much. Representative Lucas.
Good morning, Mr. Chairman. Honorable Chairman and members of the Senate Health and Human Services Committee, thank you for the opportunity to share my thoughts on HB 232. I am testifying in opposition to this bill. For the record, I represent Grafton County District 7, which includes the town of Campton and part of the Waterville Estates Village District. I am also a retired physician. I completed board certification in obstetrics and gynecology and practiced and taught that medical specialty for 37 years. I currently serve on the Health and Human Services Elderly Affairs Committee, the New Hampshire Commission on Aging, and several advisory councils. I am concerned about two aspects of this bill involving patient confidentiality and patient safety. We've already looked at definitions in this bill, Roman numeral 5 under chapter 126-EE, which is page 2, line 12. There's a long list of employees, including hospital or clinic employee. There are employees who have not had medical training, but nevertheless have vital roles in the support of a healthcare facility. The receptionist who registers the patient, the custodial team responsible for cleaning, examination, and procedure rooms, the building maintenance crew that plows the parking lot, clears the sidewalk, keeps electrical and plumbing utilities functioning, are enabling patients to access care, including abortion care. They are all employees of the hospital clinic. I am concerned that passage of HB 232 would encourage unauthorized access to medical records by any employee to facilitate the exercise of a right of conscience, and in so doing, commit a violation of the 1996 Federal Health Insurance Portability and Accountability Act by failing to comply with HIPAA regulations. That would also apply to any physician, nurse, pharmacist, paraprofessional, or student who is in the building but is not directly participating in a particular patient's care and who attempts unauthorized access, use, or disclosure of the patient's records. HIPAA violations can trigger severe civil penalties, professional licensure disciplinary actions, and criminal charges. Another concern is patient safety. Some individuals may feel compelled to seek employment with abortion providers with the intent to sabotage patient care. If a woman who has an ectopic pregnancy or is in the process of a spontaneous abortion or miscarriage is turned away by a misinformed staff member exercising the right of conscience, that dangerous delay in care as the patient searches for another provider may result in her loss of future reproductive function, fatal sepsis, or death from catastrophic hemorrhage. Some staff members with medical training may also invoke a right of conscience to deprive a patient of needed care, and this is certainly happening. More than 100 pregnant women in medical distress who sought help from emergency rooms were turned away or negligently treated just between 2022 and 2024 after Roe v. Wade was overturned. Women living in states that have abortion bans are nearly at twice the risk of dying during pregnancy, childbirth, or in the immediate postpartum than women who have unimpeded access to reproductive health care, including abortion. HB 232 is a proxy abortion bill that would have very dangerous unintended consequences, and I ask that you please vote ITL. Thank you.
Thank you. Any questions from the committee? Thank you very much. Dr. Young.
Good morning. Thank you for letting me speak. I appreciate your devotion to this state we live in. My name's Dr. Og Young, and I'm opposed to House Bill 232. I'm a retired OB/GYN, having practiced 40 years in Concord. I taught Dartmouth medical students every day throughout my career. I'm also a past president of the New Hampshire Medical Society, and I've represented New Hampshire obstetricians as I served on the general council of the Medical Society for 20 years. This bill makes no sense to me. If it were made to be law, it would serve no purpose. Let me be very clear. In 40 years of practice, I never saw a physician, a medical practice, a hospital, or any other medical institution ask a provider to perform or participate in an abortion against their will. I would like the sponsors of this bill to show me an example where a care provider was made to terminate a woman's pregnancy against his or her moral or ethical convictions. This bill actually offends the medical profession. It suggests that as doctors, we're asked sometimes to provide forms of care against our will. As caregivers, we do not need to be protected from providing care that we choose not to provide. I practiced OBGYN in a 5-physician group for many years. 3 physicians in our group felt strongly that women should be able to choose if and when they wanted to have children. And we supported our convictions by providing abortion care. The other 2 physicians in our group believed that abortion was not consistent with their faith, and they did not perform abortions. We remained very respectful of each other. We never asked any of us to change our convictions. The 3 physicians providing abortions never suggested that the other 2 physicians perform an abortion because we knew how they felt. And we provided a termination of pregnancy for one of their patients if that was their choice. So I really do believe there is no problem. We do not need to create a solution, a law that tries to solve a problem that doesn't really exist. House Bill 232 just doesn't make sense to me. The law would serve no purpose. This bill seems much more about politics and not about protecting care providers nor good health care for women. I urge you to oppose House Bill 232. Thank you. I'm happy to answer any questions.
Are there any questions from the committee? Senator Long.
Thank you, Mr. Chairman. Thank you for your testimony. So what I've heard, and I want to be clear, if there was someone other than a physician that had a moral obligation to not get involved with abortions, that would not be an issue and they would not have to treat somebody?
That's correct. We had a number of women who worked in our office who were anti-abortion. They never were asked to participate in that procedure.
Very good. Thank you.
Thank you very much. Are there any other questions from the committee? Senator Birdsell.
And thank you for taking my question. I appreciate your testimony, but in your practice, that was practiced. But it sounds like that there are some instances out there that practices aren't adhering to the federal law. Based on what the sponsor had said, that his wife did take care of someone who was made to participate.
Yeah. First of all, family medicine practices don't perform abortions. And she wasn't made to perform an abortion. She just left because she didn't want to be part of a practice, I guess, that referred those patients for abortion. So I think I would need to hear from his wife about the situation specifically. It's hard for me to imagine that she would have felt coerced to provide abortion care and was squeezed out of the practice because of that.
Any other questions? I have something. So when I read this bill, I the first thing I thought is, this is protective of physicians. It'll give them a layer of protection. So it will help them, be able to do their job, fulfill their moral conscience. And then I started getting letters from physicians saying, we don't need this. This doesn't exist. And you're here, a physician, saying, corroborating that. So I guess I'm on the search for medical doctors in the state of New Hampshire that have been affected by this, and this would help them. Do you have anybody you could send me to talk to, with an MD or a DO behind their name that would support this bill?
I told you in 40 years, I never knew of a physician or other healthcare provider that was ever asked to perform an abortion against their will.
Thank you. All right, last
So,
chance, Senator Abar.
thank you, and thank you for your testimony and for taking the question. As I read the bill, it's participating in providing performative abortions or sterilizations or artificial contraceptions, which could really violate somebody's personal conscience because of their faith, right?
Yeah. As I understand, the bill was amended to include only abortion. A couple years ago, it included tubal sterilization and contraception.
That's the introduced one.
Oh, okay.
That's the amended one. if you want.
I have the amendment.
All right.
Yeah, the amendment is about that. But again, with conscience, the conscience being a really big part of this. And previous testimony talked about, well, the person can take another job someplace else that doesn't do this, right? So my concern is the testimony was that this federal law was being broken. Somebody decided not to take action. Why? Well, is it a difficult thing to file a federal lawsuit versus a lawsuit that is local, state, that violates state law? Is there a difference? Is there a cost to that? Reputation, time. When you file a federal lawsuit, that's a big deal, in my humble opinion. In your testimony, you said you've never run across this, but that doesn't make it clear that it doesn't happen in the fact that 47 of the states have enacted something like this. I'm just curious as to why you would be really opposed to that if the 47 other states have done this. It's not clear to me, even though you said you've never run across this. Protecting somebody's conscience is a very, very important, whether if it's one person, that seems to be a valid argument. I mean, because this is a serious issue.
Well, I can tell you that the American Medical Association specifically states that no provider has to perform or provide health care against their moral and ethical convictions. That's very clear.
But that doesn't necessarily solve the problem.
I'm having a hard time knowing what the problem is.
Well, we have testimony from the sponsor that someone was forced against their will to have to do this or leave. That's a problem. That's the impetus of this bill, from what I understand. And 47 other states do this.
So I heard him say that his wife was part of a family practice where one of the physicians left.
I've been seeing him shake his head a lot when through your testimony, so that's why I'm trying to, tease this out a little bit.
Yeah.
From what I understand, it was something that violated the individual's conscience as the bottom line. So that's the impetus of this bill. And the fact that 47 other states do this, they narrowed it down to specifically this type of practice. So why wouldn't we protect somebody's individual's conscience on this particular issue? One could be thought of without acting. This corporations or practices could actually purge out those that have a right of conscience on this particular issue. That's another concern. But according to his testimony, his wife was against her will forced out. Correct? Or is according to your testimony, Representative?
Well, I'm sorry that person isn't here to actually provide a voice to why she left the
Her
practice.
husband is. No, you're not.
I'm gonna have you hold, we'll get you back.
Yeah, I'm not trying to be argumentative. I'm just, it's a matter of, this to me is a very serious, it's been a serious issue for years, since I've been alive. There are those that really want to practice medicine, want to be part of a, say, Dartmouth or an organization, but they don't want to be involved or engaged in this, and they don't want to have to be fear of repercussions if they decide not to participate on some level. I don't see what the problem is in protecting those individuals. That's all. I'm willing to listen to you because of your experience in this. So I don't know if that's a question. Maybe it's more of a statement. Yeah. So, thank you.
Thank you, Senator. I do have a question. Could you send me the statement that the AMA has about, statement of conscience? That would be helpful, I think.
Okay.
Yes, thank you very much. Any other questions from the committee? And you can send it to Sophie and she'll send it around to the rest of the committee.
Okay.
Let's see, Rebecca Hoskins. Rebecca Hoskins? No? Going once, going twice? All right, we're gonna pass on that. Chair calls Rachel Potter. And Representative, are you gonna hang out for two more speakers? We're gonna get you back here. Thank you.
Thank you, Mr. Chair and members of the committee. For the record, my name is Rachel Potter and I'm Policy Associate at the ACLU of New Hampshire. The ACLU strongly believes that healthcare providers deserve religious freedom, but we also believe that patients deserve access to care. And laws should balance those interests, not grant sweeping refusal rights that jeopardize patient health and undermine non-discrimination protections. And that's why we are here opposing this legislation today. We all know that hospitals in New Hampshire are already stretched to their limits. A 2025 report from the New Hampshire Hospital Association found that hospitals in the state are operating at a 90% capacity, which is about 15% higher than the national average. And at the same time, hospitals are facing severe workforce shortages, particularly in maternity care. Labor and delivery units are often the first services that are cut because they require 24-hour specialized staffing. And New Hampshire has already seen multiple closures in this area. And as a result, the average drive time to actually reach a labor and delivery unit in the state has doubled in the past decade. So legislation like this does not help to address the crisis in reproductive health care access that New Hampshire is already facing. It just makes it worse. And importantly, this bill is also extraordinarily broad. So the definition of healthcare provider that some have touched on already in this legislation goes far beyond doctors and nurses. It could include the scheduler at the front desk when you check into the hospital or the clinic, a hospital that you may have already traveled hours to reach at this point. It could include the pharmacist dispensing medication, the surgical technician preparing instruments for an emergency procedure, or the recovery room staff simply monitoring your vital signs after surgery to ensure that you survive the procedure. And the bill's definition of a healthcare institution participating in an abortion is even broader. It could include a provider at a health center where abortion is not even an option, like a community health center who merely refers a patient to care but never even performs the procedure. It could even extend to entities like an insurance carrier, organizations that are obviously not present in the room at all. And we have seen the consequences of laws like this in other states. Headlines across the country have documented women who died while waiting for life-saving reproductive care that hospitals were afraid or unwilling to provide, even though laws in their state did carve out an emergency exemption. And Granite Staters do not want barriers to healthcare here. This bill also creates serious legal risk for hospitals. It explicitly allows employees to sue their employers while preventing hospitals from raising staffing shortages as a defense. And that means hospitals could face a choice between ensuring patients receive their urgent reproductive care or risk legal liability. And as some have already touched on, the bill goes even further by limiting civil and criminal enforcement by public officials. And that could potentially shield employees from accountability, even from our own attorney general, even if their refusal violates other state laws, including non-discrimination statutes. And perhaps most important, however, is that the religious accommodation in the workplace is already protected under federal law through Title VII of the Civil Rights Act. Employers must already make reasonable accommodations for employees' sincerely held religious beliefs, and the ACLU is strongly in support of that important liberty. But this bill just goes too far beyond those protections. It dramatically expands refusal rights in a way that could allow personal religious or moral beliefs to interfere with patient safety in a way already overburdened hospital system, and ultimately will undermine medical professionalism. So we respectfully urge you to oppose this legislation.
Great, thank you, Rachel. Are there any questions from the committee? Thank you very much. Representative Orrs.
Thank you, Mr. Chairman. Representative Orrs, Merrimack 13, representing Chichester and Pittsfield. And I just wanted to testify to the fact that I support this legislation. And the reason I support it is because of the fact that in my career as a corporate executive and many other hats, I have seen the intimidation process work. And to force somebody into a situation where they have to support abortion, medical procedure or whatever, this sort of thing does happen in our country, and we just can't say it doesn't. As a corporate executive, I've had to terminate through my actions 2 presidents of 2 corporations, a vice president, and a couple other people, and let me tell you why. In the process of my career, in the first case, we had the vice president and president stealing money from the corporation. The money belonged to the Department of Defense, and instead of building a test track with the money, they used the money to build an employee complex. So how does this fit in? Well, I was the accountant and the fixed asset manager, and I was being told to hide this and bury it. And in good conscience, I couldn't do that. And I took a chance and almost lost my career at that point by going above them to other corporate. And I was told I was either going to be fired or I was going to look pretty good. Well, unfortunately for these people, they got fired. They eliminated both the vice president of finance and the president. And another scenario, working with a corporation.
And we're going to stick to the bill. I know you're giving examples, broad examples.
Very good. I'll get right to the point.
Yep.
So to put somebody through this and it can happen. You know, we talk about healthcare, but really when you're talking about abortion, you're tearing a baby apart out of that womb, usually injecting cyanide or whatever into the brain and tearing that baby out a limb at a time, a leg at a time, a head at a time. And to put somebody through that when they don't want to be a part of it is unconscionable. Thank you very much. Any questions?
I do have a question. So are you aware of any medical providers that are being forced to do this against their conscience in New Hampshire?
Not in New Hampshire.
All right, thank you. Any other questions from the committee? Thank you very much.
Thank you.
Bob Dunn.
Good morning, Mr. Chair, Senator Rochford, I'm sorry, and members of the committee. It's good to be back in Senate HHS. I'm Bob Dunn, the Director of Public Policy for the Roman Catholic Diocese of Manchester, and it will not surprise you to hear that I'm here to support House Bill 232 insofar as this bill creates greater state protections for healthcare providers around abortion and conscience. As I sit here today and hear the discussion, the first thing I'd like to say is it's amazing in this day and age that we here in New Hampshire can have this civil conversation about something that is such a difficult topic. So I think that's a good thing to note. I'm reminded of something that I read a while back that when someone looks at an ultrasound, some people see one of us. Others don't see one of us. Others see one of us but believe that there are reasons why the law should allow the taking of that life. Now, the ethical and religious directives for healthcare providers is a document that is put out by the U.S. Conference of Catholic Bishops to guide Catholic healthcare providers, whether they work in Catholic institutions or elsewhere. And although that's based on faith, it's also based on reason and natural law as well. And the ERDs require Catholic healthcare providers to form their consciences. As the introduction says, as new knowledge and new technologies expand, each person must form a correct conscience based on the moral norms for proper health care. Now, as you know, Part 1, Article 4 of the New Hampshire Constitution says that conscience is one of the most fundamental human rights that we possess. That article says that rights of conscience are inherent. It doesn't establish those rights, it recognizes them. And it says that they are in their very nature unalienable. Now, there can be no graver reason to have a person look to their conscience rights than when we're talking about the taking of a human life. I know that there are those who disagree with the church's position on abortion, but if there's to be any logical consistency within the context of abortion and within the context of choice as it pertains to abortion, it can't be that the choice made by one person is at all costs to be vindicated, while the choice made by another must at all costs be thwarted. So thank you, as always, for your kind consideration.
Great, thank you, Bob. Are there any questions from the committee? Thank you very much. The last speaker we've got signed up is Jason Hennessy, and then we're going to ask the prime sponsor to come back. So Jason, if you want to come up.
And just for the record, I don't plan to read the whole thing. I just have a couple quotes in there that I need to.
Thank you. We
reference.
appreciate that.
Hi, my name is Jason Hennessy. I'm the president for New Hampshire Right to Life. New Hampshire's largest pro-life organization. And I'm here to support HB 232. Many of you will remember the story of the Uyghurs in Western China. They were forced, I believe millions of them, to go into camps, and being Muslim, they were forced to to take place of in Chinese culture by eating pork. And most of us find that repugnant. And in a similar way, many Christian and even non-Christian medical practitioners would find abortion to be the taking of a human life, which is very much against their religion. And so I would say that probably the orthodoxy of most religions in the world, as well as even atheists and agnostics and many feminists, oppose abortion. Even the Hippocratic Oath that many physicians take that specifically forbids helping in an abortion. As you've heard, about 47 states, 96% of this country have a law to actively protect the conscience rights when it comes to abortion, or more generally. And I've also heard that there's some concerns about finding examples. So one example in next door in Vermont that I want to talk about was it was taken action on by the United States HHS, and I'm just going to quote from them. It says UVMMC, University of Vermont Medical something center, forced the nurse complainant to assist in an abortion against the nurse's religious or moral objection. The nurse had expressed an objection for many years, and it was included in a list of objectors, but UVMMC knowingly assigned the nurse to do an abortion procedure. The nurse was not told the procedure was an abortion until the nurse walked into the room, when the doctor, knowing the nurse objected to assisting in abortions, told the nurse, "Don't hate me." The nurse again objected, and other staff were present who could have taken her place, but the nurse was required to assist with the abortion anyway. If the nurse had not done so, the nurse reasonably feared that UVMMC would fire or report the nurse to licensing authorities. Another article reports that the nurse left the position and has been traumatized ever since. And then the HHS report also mentions that there were several other healthcare professionals at UVMMC to whom this had happened. And given this, and given the fact that the HHS and DOJ had taken action, you would think, okay, job done, go home, federal law worked. But it turns out that as soon as the administration changed, within a few months, completely dropped the case. And this is why we need a New Hampshire law. We cannot depend on a fickle federal government to help us. We need something that we can do here to protect the consciences. And if you think that this only happens in other states, I can point you to a policy on the Dartmouth-Hitchcock website that specifically requires their resident physicians to refer for abortion, even if it's against their conscience. This is the policy. You can go look it up. And that's just what's on the public. I don't know what their policies are for their own personnel who are not resident physicians. It may have similar things. And I'll also point out that I personally had a friend who was a Dartmouth medical student. And when I asked her, would you consider residency here in New Hampshire? She refused because she said, Dartmouth is known for pushing abortion on their medical residents. I don't want any part of that. And so she has since left the state, and as far as I'm aware, never came back. And now, in terms of the physician shortages, I want to point out there are two studies that I'm aware of that are peer-reviewed that have looked at the percentage of OBGYNs that actually do abortion. And the range is between 7% and 14%. So if you want to be able to recruit OBGYNs to the state, do you want to appeal to the 7 to 14%? Or do you want to appeal to the 85 to 94%? I would suggest that a law like this, especially in light of the fact that Dartmouth is our largest healthcare provider in the state, will allow us to actually recruit and retain OBGYNs. Just a couple of other things I wanted to address. In terms of the the language in the bill that says that if the majority of or if abortion is a major part of a business, that this doesn't apply, I would argue that that is very unclear language. In a survey that I did of many other states, I did not find any language like that, and I've heard absolutely zero testimony that that's ever been a problem. So if you have many states without that, then I would suggest that we don't need that, because it's just going to create problems with its vagueness. And in terms of healthcare concerns, we support having an emergency exception. Thank you.
Thank you. Are there any questions from the committee? Seeing none, thank you very much.
Thank you.
Representative Pearson, if you could come back, I think there's some questions of the committee for you. Senator Avar, did you have a question for Representative Pearson?
Yes, could you clarify my understanding of the individual?
Remember, I chair the DIF Commission for the state, and I am one, so.
Hi, how are you? Good. So could you clarify as the story of the individual that was forced to, in your opening dialogue with us?
You know, it's okay if the committee wants to tweak and make some changes. And I heard some good ones from people who otherwise oppose the bill. What I do not like is being misrepresented, and especially do not like being misquoted. My wife is a family practice physician. She mentors young women physicians, MD, DO, around the state who are not necessarily family practice doctors. So the fact that someone said he'd never heard of this happening in family practice, I agree with, and it's irrelevant. This person who was fired and limped off to another state was not in a family practice position. It was in a position where abortions literally were taking place, where others could have stepped in. You know, I was just thinking on the way up on how Christians cover for Jewish people on their holidays and vice versa. This bill would not disallow that. This bill would say, fine, if there's 5 of you and it's 3-2, let the 3 cover so the 2 don't have to. And there are people of conscience who do that. But there are places where conscience is not observed. And that is what took place.
Thank you. Any other questions of clarity from the prime sponsor? Thank you very much, Representative.
Sure.
Is there anyone else who'd like to speak on House Bill 232? Courtney, is that, all right. Saw you standing back there. I figured you were.
Well, sometimes I have to stretch my legs too. So,
all right.
Thank you so much. Sorry to not sign in. Courtney Tanner, I'm the Senior Director of Government Relations at Dartmouth Health, and I didn't want to have to go after Bob Dunn because he's the most eloquent. So I'm sorry to have to sign in late. We are, at Dartmouth Health, we have 16,000 employees across the Dartmouth Health system. And many of those are learners. We have OB care services, OBGYN services in Lebanon, all the way down to Bedford. So we're providing care across the state. And what's really important for us is, one, we want to ensure that we have access to care for our patients, all types of care, including OB services and reproductive health care. But also, equally important is that our employees feel welcomed, that they belong, and that they're safe, and that they're respected in their employment. And so workforce retention is extremely important to us. We have 1,500 clinical vacancies at Dartmouth Health right now, and so it's really critical to us, one, that we're respecting our employees, but two, that we're also complying with federal law. And so we don't believe that this bill is necessary in New Hampshire. We know that there are federal protections there's process if those federal protections are violated by employers. It's unfortunate that this happened in the state. And if it happened in the state, as an attorney, it's helpful to seek remedies for that so that those can be tracked in the state. And it sounds like that didn't happen. But there is a remedy through the Office of Civil Rights currently that New Hampshire citizens are afforded to if this happens in the state of New Hampshire. Passing this statute isn't going to change somebody's ability to access remedies because we already have a federal remedy process. So I personally don't think that this is really necessary at this point. If there is, if this committee feels like there should be protections on state statute, I would have some concerns about our inability to comply with both federal and state law, because I'm seeing some contradictions with the state proposed statute and the federal protections. And so just want to walk through a couple of those. And when there aren't direct contradictions, would have concerns about vagaries. So one, we've talked a lot about the definition section in terms of not limited to. I would have concerns about access to care issues. So if it is a receptionist, if it's an LNA rooming a patient, there's no requirement in this proposed bill that there's a warm handoff. So what happens if a patient's just sitting in the waiting room and there's a refusal to room a patient, but that's not communicated to that employee's colleagues? There's no provisions in here around access to rural care. We know that in many of our clinics or small pharmacies or small healthcare providers across the state, there's 1, 2 people. And so would have some concerns about access to care in places where there are just less employees. Operationally, we would have some concerns about how do we operationalize this when an employee asserts protections. This is a pretty strict protection in that there cannot be a transfer of duties. There cannot be any transfers of administrative responsibilities. That's even more strict than things like the ADA that allow for reasonable accommodations. So there's really hamstrings our ability to operationalize care as an employer. Again, we've talked about questions around how do you define major parts of services for Dartmouth Health? Is that a major part of our system? Would it be for that one facility? Is it for the service line? So we would need some clarity around what major parts of services looks like as we think about that definition. Finally, I would just raise up how we collectively are balancing patient rights and the rights of the employees. So as we think about, we very seriously take the patient's Bill of Rights at Dartmouth Health, as I hope most of our healthcare providers and institutions do. So how are we balancing patients' access to care and their rights to access of that care and this state statute? So, again, I just want to preface, we stand behind all of our employees. We want to respect them and make sure that conscience is respected. And we want to make sure that these other pieces are also contemplated. And so if there's work to be done on this statute, we'd want to be at the table to think through those pieces.
Thank you, Courtney. Question from Senator Avard.
Thank you, Courtney. Appreciate you
course.
coming up. So just one question regarding one of the previous
Sure.
testimonies.
I had a feeling you were going to ask me about that.
He did, and I was going to.
Yeah, good.
Well, it seemed as though, if I understood the statement that Dartmouth mandates, regardless of conscience, and you could look it up, it was stated that the services of, that might violate your conscience must be done, otherwise you can't work here or something.
Sure. What I heard from the previous statement is that there's a requirement for those are providers who are learning to practice care. I am going to go back to our team and ensure that we are complying with federal law, that if there are objections, that those are respected and protected for all of our employees, including our residents. So my answer would be Dartmouth Health complies with federal law and that those protections stand.
And before you follow up, I'm going to say, when you find that out, send it to us.
Yes, absolutely.
All right, now your follow-up.
Yeah, ditto.
Yes. Yes. You know that I will be contacting you. Yes.
Any other questions for Courtney? All right, seeing that, does anyone else like to speak on House Bill 232? We're going to close the hearing.
Where'd he go? Did he leave? No, the other pen. Was that it?
I'm going to open the hearing on House Bill 1763, establishing a committee to study siting and maintenance rules regarding certain intellectual and developmental disability and acquired brain disorder community residencies. I'm going to call Representative Drago if he's here. If there's not, Representative Barber, are you going to introduce the bill? Thank you very much, Representative, for introducing the bill. I'll let you have the floor here.
Thank you, and good morning. Thank you, Chairman Rochford and the committee members for the opportunity to testify today as a sponsor of HB 1763. For the record, my name is Liz Barber, and I represent Hollis, District 35. This bill establishes a legislative study committee to examine whether existing administrative rules governing the siting, operation, and maintenance of community residences for individuals with intellectual developmental disabilities and acquired brain disorders are clear, sufficient, and properly coordinated with applicable laws and neighborhood character. I want to be clear, we are respectful of the federal protections afforded to individuals living in these homes and the importance of community-based residential settings. This bill creates a structured forum to hear from those closest to the issues, including the Department of Health and Human Services, neighborhood residents, providers, advocates, municipalities, and emergency service professionals. Our goal is to find solutions to assist both the community housing residents and their neighbors create safe and supportive neighborhoods. Across the state, concerns have been raised in established residential neighborhoods where community residences exist. At the House hearing, we heard that local in-state agencies are not at issue. Rather, it is often the new out-of-state providers that abuse the New Hampshire system. They are not familiar with the level of respect and compliance that local organizations have for New Hampshire rules and regulations. They simply don't appreciate the New Hampshire way. We need a mechanism to deal with issues outside of the home that negatively impact the neighborhood and can push both neighbors and house residents at risk. These issues include trash removal, property management, excessively high fencing that is out of character for the neighborhood, and the parking of multiple cars on the properties and on the streets. The home located in my town of Hollis had a pool. Neighbors reported over 18 cars parked along the street one day. Apparently, the staff had a very disruptive pool party, not resident-focused. Staff speeding up and down the neighborhood streets can seriously injure or kill a child. We heard of unmonitored residents eloping from the properties and wandering into adjacent homes, endangering themselves and potentially endangering those who live in those neighborhoods. These are complex issues, and there must be room within a lawful framework to consider neighborhood welfare. The reality is that neighborhoods represent a significant personal and financial investment for the families who live there and therefore deserve to be part of the conversation. I want to commend the Department of Health and Human Services for their active interest in addressing these matters and for prioritizing the concerns raised by my Hollis neighborhood. This bill, at its essence, is intended to support DHHS in their vital work by providing clearer, more coordinated rules and better statewide guidance that will help them to enforce standards more effectively, reduce inconsistencies from out-of-state providers, and ensure the system works smoothly for everyone involved. We look forward to creating a body of work that supports DHHS. By choosing a study committee, the legislature is acknowledging that these concerns deserve review. This bill allows us to gather information, hear from all stakeholders, and identify lawful, practical areas for improvement. For those reasons, I respectfully ask the committee to support HB 1763. Thank you for your time, and I'm happy to take any questions.
Thank you, Representative. Are there questions from the committee? Seeing none, thank you very much.
Thank you.
Appreciate the time. Chair calls Marissa Berg.
I will start by apologizing. I am at the tail end of a cold. I will do the best I can. Please feel free to ask me to repeat if my voice doesn't work.
We're going to ask you a ton of questions.
I will do I spent the whole week talking, so I'm not doing myself any favors. So, thank you, Chairman Rochefort and other members of the committee. My name is Marissa Berg. I am the Executive Director of Community Support Network. We are the association representing the 10 area agencies in the state, and I am here today to ask that you find HB 1763 inexpedient to legislate. You do have quite a bit of information in front of you, including information on the Supreme Court ruling from many years ago regarding the citing of properties and homes that support people with developmental disabilities, in addition to information from the Fair Housing Act. I do appreciate, there's certainly a lot of sides to this issue. This bill is proposing a committee that studies the siting and maintenance rules. And while the concerns that have been raised by a small number of residents in certain towns, there are over 1,000 programs in the state of New Hampshire that serve people with developmental disabilities in a residential setting. So I just want to highlight that it's not a huge number of programs that I believe were included in what initiated this bill. So one of the things that I want to highlight is that the Fair Housing Act is really clear, and that the Department of Justice has stated that you can't use, municipalities can't use zoning or land use decisions to exclude or discriminate against people with disabilities. Any study, commission, or a committee whose work aims to change those rules, we are concerned that that would be leading New Hampshire into conflict with federal law. I included as well the Supreme Court ruling from 1980, Region 10 Client Management versus the Town of Hampstead, and that the entire ruling is included in your materials. The court found that the statutory scheme of placing people with developmental disabilities throughout the state carries out a state policy that can't be frustrated by local zoning restrictions, and that has been in place for 45 years, and thus far has worked quite well. New Hampshire is a fully community-based state, individuals with developmental disabilities in New Hampshire, we don't have any institutions. People are fully living, working, socializing, and living their lives in the community, which is something that we're really proud of here. We are concerned as well that about the committee, the Housing Impact Study Committee that was created under 2024's House Bill 1168. This was a dedicated committee that looked at the effects of the housing crisis on people with developmental disabilities. There was a lot of community support for that bill back in, it took place late 2024. A lot of community members that participated in those really meaningful discussions. And unfortunately, my understanding, even though there was an appetite to continue that study committee throughout the next year, there were some, the legislative staffing just wouldn't support, continuing that work. And I am concerned that this could create another situation similar to that. And finally, I also want to highlight Senate Bill 670, which is something that CSNI is very much in support of. That's the creation of another study or another oversight group that looks at the quality of services for people with developmental disabilities. And we do feel that some of the issues that had been raised could be better suited to discussion in that body instead of creating a separate committee to look at the siting and maintenance concerns specific to programs that support people with disabilities. Finally, I want to just really highlight these programs exist because there are individuals that are currently served out of state, and there's an intent to bring them back home to New Hampshire. Some individuals that we support in this system do experience behavioral health challenges in addition to their developmental disabilities. So the discussion about things like fences and lots of cars, I certainly understand that. But the cars might be, and I don't know the specific details of each house, but there are some individuals who require a lot of staff support, sometimes one-on-one, in order to engage safely in the community. So, there are certain aspects of disability that might be misunderstood or a challenge for some people to understand. So I just want to highlight that, there's sort of a line there that might be tricky to manage. So, again, these are individuals with community-based lives, and I would just ask that you consider that when thinking about this bill. Thank you.
Okay, thank you. Senator Abart has a question.
Thank you, and thank you for your testimony. I'm just curious, this isn't eliminating a previous study, it's adding a new study, is that correct?
That's my understanding of this bill, yeah.
Right.
Yep.
That's it, thank you.
Any other questions? So I know, Senator Long, did you have a question? All right.
Thank you, Mr. Chair. So it appears from what you said that department staffing, there was no division that oversaw this. Was that the issue?
No, so there are existing rules that are in place that these programs did fall under and continue to fall under. But the rules that are in place have been in place for many years. And again, for the over 1,000 programs that exist in the state and have been in existence for quite some time, those have worked well. So there are existing rules in place. It's HEM 1001. That's the certification
Follow up,
rules.
certainly.
So House Bill 1168 in 2024 disbanded despite strong community support. Why again did it disband?
So that bill, my understanding, that was I believe the actual title of it was to understand the effects of the housing crisis on people with disabilities. It was a group that also looked at the fact that access to housing is really difficult. Access to accessible housing is really difficult. People with developmental disabilities sometimes experience things that they need in a home that aren't necessarily covered by the ADA. That group did also hear from licensing and certification on some of the struggles for that people with developmental disabilities might have when trying to access homes in the community and to find places to live in the community. And my understanding is that that even though there was a decision made during, by that body to continue for another year, it disbanded because there was not appropriate legislative, there wasn't the bandwidth to continue.
Very good, thank you.
Thank you.
So I appreciate your testimony, and you brought something up. You said it's a small number of communities, small number of complaints that are affected by this. But me personally, I got 3 communities in my district that are having troubles. And I've heard from public safety officials, police chiefs, fire chiefs, EMS. I've heard from select board. I've heard from community members. And there appears to be, at least in Senate District 1, a significant growth of these facilities. And communities have questions, and public safety providers have questions. So, I mean, and I think they're real questions. They're real good questions. When something shows up on a dead end street in a quiet residential community, and according to the contract, it's for individuals with pedophiles and people with fire setting tendencies, it raises some concerns as it should in the community. So I guess, you're saying we should kill it's a study bill. It's just a study, so look at it. So your testimony is saying, no, we got to ITL this thing. We're not going to look at this. We're going to, look the other way. What do I tell my constituents that have some real concerns with this?
I would say, thinking about first off, thank you for the question. Based on, some of that feedback, thinking about the individuals that are supported in certain homes with certain disabilities, my recommendation in here is to instead look at that from a quality concern. So anybody who resides in a program that is supported by the Home and Community-Based Care waiver does have a developmental or intellectual disability or a brain injury. So anybody who qualifies for services in the programs that would be included in here do have a developmental disability. So it's, I think that there's also some confusion around certain, people who are in maybe substance abuse recovery or mental health disorders. Anybody who is supported by these programs has a intellectual disability or brain injury. So
I would contend that this study bill would just do that. I mean, if it's a quality issue, the bureau chief of the Bureau of Developmental Services is going to be called to testify. We're going to have folks from the Disability Rights Center being called to testify, area agents. So, I think that this would actually help your case rather than hurt it. I mean, you can make that case because and I've dug into this situation, and it is complex. It's not as simple as saying, that. And I think that this is a step to do that education for folks on this side of the table. I think you have a good opportunity here. I'm concerned that your position may be one of you're missing an opportunity. And would you agree with that?
I would say our concern is that we fear that this opens the door for communities to be able to say that they do not support having people with intellectual disabilities live in their community.
I'm going to stop you there because you know as well as I do what the law says. So they can say whatever they want, but you can't break the law. But maybe there's a way to bring in these issues and talk about the quality, talk about communication. Because I've taken a shallow dive into the law and it's very complex. And I think that, just my opinion that might give them an opportunity to actually help your case rather than hurt it. Senator Abar, did you have a question?
Well, I think you basically expressed my feelings. I mean, we're just looking into it. It's not binding. It's more or less giving more sunlight to the issue. I can tell you on this committee that I'm very strongly supporting the DD community. I think I have a long history of that, and I would definitely like to see other avenues where we could help in that community. But if there are some concerns, then let's address it. Let's not be afraid of it. I think would you agree?
Again, the position of CSNI was the concern around looking at this from that this could turn into a situation where this is looked at as a zoning issue or a municipal issue as opposed to a quality issue. And certainly, from everything that we've heard on this bill, there was cited about the trash and things, people eloping, that's a quality issue. And sort of thinking about this from the perspective of SB 670, which is an oversight commission that is intended to look at the quality of services that are being provided. Is it necessarily the rule that needs to change, or are we dealing with a quality issue for those specific agencies?
Mayor?
Yes.
Yeah, so, let's just be frank. If there's a couple of individuals that are living in a home and it's not being maintained right, and you have a slumlord situation, don't they deserve better than that? And don't the neighbors
Absolutely.
also deserve better than that? And so looking into that to make sure that quality that you mentioned is definitely being taken care of, because, look at all these beautiful houses, and look at that slum thing right there. Well, that's That's not helping your situation. So if we can address that situation, nobody wants the DD community living in squalor. I'm a cleaner. I clean places like that. I know they exist, and it's not good. And so just having a committee to say, hey, look, we need a little bit of vision in seeing how we could provide better care. Yeah, it might include zoning. Clean up the mess. If there's a mess, if there's a house that is not being taken care of, why do they deserve to live in a house that's not being taken care of? And so, again, nothing binding here. Why not look into that so that their quality of life is being taken care of? Because they can be overlooked. I've seen it.
Again, the concerns, some of the concerns that we have are really the thing that stands out to me is the fencing and the parking. Because for those programs, I mean, the installation of fencing like that is a very significant investment for those agencies, and it's there for a reason. And I certainly don't want to go into details that could, I would just ask to consider a lot of those investments and a lot of those struggles are required for those individuals to be able to live in the community. I would absolutely agree that, nobody deserves to live in any sort of squalor. Everybody deserves a nice home in the community. And I think the concern is specifically around citing, the siting of some of these homes. So as long as there was a focus on quality, I think we would be open to that discussion.
Thank you. Any further questions? Thank you.
Thank you so much. I appreciate it.
All right. Let's see. Matthew? Welcome.
Thank you for having me. My name is Matthew Cordero. I'm the CEO for one of the area agencies. I speak only for myself and for my area agency. I do not speak for CISNY or any other organization except for a provider agency I am the interim CEO for, which is Farmsteads of New England. We have many different community residences, and then with One Sky, we own residences that are community-based, and we rent them out to provider agencies. I'm an avid supporter of this bill. When you look at the situations that have occurred, trash is a small issue. We can fix that. Licensing deals with it. But we have people who are not getting the services that they are promised to get. One individual was allowed to leave the residence and enter into the residence of a neighbor. Luckily, that neighbor recognized that person as being a person with a developmental disability and did not shoot them, because that's New Hampshire. We all have guns, and it's a great state because of that, in my opinion. So when we're looking at these circumstances and situations, I'm looking at this as being an opportunity for us to address issues in our system. We have many bills coming forward right now because we have opportunities in our system that need to be fixed. 3 years ago, our system changed. All the money and contracts used to flow through the area agencies. So if you had a community residence or you had a community residence and you were not following along with the program and doing the right things for the individuals that we supported, we could suspend your funding, we could pull your certifications. But 3 years ago, that all changed. And so that doesn't happen. We don't have the ability to do that. And when the people who changed the system 3 years ago and they're gone, and the people that we have now are fantastic, and I would name all of them, but I don't think that's appropriate. They're all amazing though. Came in and started fixing the issues that came forward. These issues weren't front and forward because it was all New Hampshire-based providers. New providers came in from out of state, and they're exploiting the loopholes that we now have. We don't have a way to fix these situations at the time, or at the present. We have our bureau chief, we have our director of long-term supported services going out on Sunday evenings and doing site visits, but they can't do anything to those providers because the mechanism for that rests with licensing and certification. But licensing and certification can't do anything because the things that they're doing isn't covered underneath the rules and the regs. So we have basically these providers going out and providing terrible services, not doing the right things, but what they're doing is outside of the scope and purpose of what we can hold them accountable to. This study group allows us all to sit at the table in a very collaborative way and to figure out the situation and the problems. This concept of I'm afraid of this and I'm afraid of that and these concerns exist and all that stuff, we can all be afraid of anything. I could walk out of here and suddenly grow hair.
Wow.
I know. And could it happen? Yeah. The likelihood of it happening to me is, God willing, I'll get struck by lightning, I'll have a full head of hair, but the likelihood is it's not going to happen. And if we have a collaborative group sitting around saying, okay, we have to make sure that people aren't excluded from the community, because that is very important to me, and I will fight like a rabid dog if that happens. If we have people around the table ensuring that people are getting the services they need, these things, these problems, these concerns, these fears, these I feel statements don't really matter. And these recommendations ultimately are that, in fact, recommendations. And they can go back to the Bureau and then they can go through the GELCAR process. This is not what I would say a burn the house down moment. We don't have enemies at the gate. We don't have barbarians battering down our walls. We have a situation, a problem, and a concern. We have people that are coming forward with what I think is an extraordinarily reasonable approach to this. And I'm just asking that you support that approach so that we can come to the table as professionals. I've been doing this for 20 years in this role in one way or another, from Florida to New Hampshire, to Maine, actually. Working either for companies myself or as an industry expert. This is probably the first piece of legislation where I've seen where the legislators aren't trying to fix the problems themselves. They're saying, hey, listen, this is so complicated. Let's get all the industry experts together and figure out some solutions and then let it follow through the natural course and process. Probably one of the best pieces of legislation I've seen in my entire career. So with that, I'll stop jabbering.
Senator Abart has a question.
Do you mind if we remove the senators from the study?
I don't care. I mean, realistically, whoever's willing to be a part of it needs to be someone that wants to be a part of it.
We can discuss that.
Discuss it.
Yeah, we can discuss that.
No worries. Thank you.
Thank you, guys. Is that it? Any questions?
We
Thank
get
you
in
all.
trouble over here when we start chatting.
I feel like I got let off easy, so thank you.
All right. Thank you very much, Matthew. Does anyone else like to talk on House Bill 1763? Yes, Karen.
Is it still morning? Thank you so much. I realized I didn't sign up. For the record, I'm Karen Rosenberg. I'm the policy director at the Disability Rights Center. And thank you again. I wasn't planning to testify or take a position on this bill, but I think that some of the testimony I heard did raise some concerns about the focus and also whether it's the best use of resources. So what I heard was that there were some really troubling incidents that occurred in some of our communities, in a couple instances, involving developmental services and people served by that system. And from our view, those things occurred because of a lack of oversight, a lack of supervision, perhaps a lack of training of the individuals who were charged with designing those programs and implementing those programs and providing what it is that people with developmental disabilities, I think it's actually maybe one individual in particular, needed. And Senator Rochefort, your bill, SB 670, provides such a wonderful opportunity to, it's about oversight, it's about monitoring, it's about quality and looking at, what are the gaps in our system that have resulted in some pretty tragic events. And I would consider someone with a developmental disability who's not getting appropriate services to be in that same bucket. And so it takes resources and people's time and to commit to really doing the work that needs to get done. So it's, I'm happy to go. I'm happy that our organization was named in this particular bill to provide input. But Senator Rochefort, in your bill, you have a robust commission that is comprised of a diverse group of stakeholders with a lot of firsthand knowledge of the client community, the rules, the challenges, the financing, all in one place. I think that if, when it comes down to looking at resources and how we're using them, we can address concerns that are raised by this bill in a way that you identified. The fair housing law is the fair housing law, right? This is the universe we're operating under. If it's about quality and services and oversight, we can accomplish that in the commission that would be established by SB 670. So.
Well, I appreciate your comments, and since you invoked me by name, I am going to comment back. I think 1763 would be a perfect complement to 670, and I think that 670 addresses some initial immediate needs, but I think there's some other issues going on further. I could do a replace all amendment on this bill and come up with the legislation. But I think that Representative Barber and Representative Drago, I think they're approaching this correctly, because there are issues that we can't get around legislatively. And there are discussions that need to happen, whether they're quality issues, whether they're other things that have come up. I mean, I think this is a great forum to continue the discussion. And, you mentioned my bill, 670. It's my bill. I don't have I'm not threatened by this at all. And I don't think this will take away from 670. I think this will add to 670. So that's my take on this. And probably I tipped you off on how I'm going to vote on this bill. So
I appreciate your time. I was just trying to save everyone's, but
all right.
Thank you.
Thank you. Senator Long has a question for you, Karen.
Thank you, Mr. Chairman. And thank you, Karen. I know Manchester had the same issue. And what concerned me was that the people living in the house needed that. However, the neighbors were coming to the Board of Mayor and Aldermen very negatively. And that kind of concerned me. So I lean towards this bill for the precise reason that it's going to be looking at. Do you really see 670 being able to address this?
I do, because I guess the lens I see, the incidents that provoked this bill, I think are around oversight and quality. And I think that what concerns me about this bill is having a term like neighborhood character. That's the kind of term that was used to exclude Black people from certain neighborhoods or Jewish people from certain neighborhoods. Because, if we have a synagogue in an area, it could change the neighborhood character. And so that, that's a lens that is very concerning to me. And people need to be educated. People didn't want Irish people moving into their neighborhoods or Black people moving into their neighborhoods. And the law changes, and then people need to adapt to the law. But we also can't have situations where, as Senator Evard was mentioning, people living in squalor or people who are interfering with other people's right to, quiet enjoyment of their own premises. There has to be some balance, but it needs to be it can't be based on them having a developmental disability or, their color. This isn't about that. But, I think here the issues have really had to do with supervision and oversight and monitoring and quality of services. And so maybe some Manchester residents didn't want those people living next to them, but that is illegal and wrong.
Okay, I get it. Thank you.
Yeah, you said people need to be educated, and I agree. And I think the more light that we can shine on the community, the better. And I think having done many studies, I find very helpful to me when I can tease out the information that I need to make improvements. When a state rep or a senator asks for a study, I generally, they want to be educated. That means they want to take the time to look into it. And if there's a blind spot, which I think we've established that there is, this is one way to tease that information out, not to discriminate. That is the last thing on this committee, or I believe on the intent of this bill, to discriminate against individuals in the DD community. That would be war. It would be, because they are our most vulnerable and they need things that we take for granted. I think a study like this, it shines the light on certain areas that I believe, in my humble opinion, will help educate our state reps and give more sunlight to that community. I think the more sunlight you give to that community, the better.
And that's fine. And it's why, I mean, like I said, we weren't taking a position on the bill. And I was really happy to see that my organization was specifically listed as an organization this committee would hear from. So that is an opportunity. I was, concerned about the theme and concerned about just how many committees you all are asked to be on and we're all asked to participate on. But if this passes, I will happily be there and provide whatever that's helpful that I can.
Great.
Thank you very much. I don't have anyone else signed up to speak on 1763. If there's no one else would like to talk, I'm going to close the hearing. And I'm going to open the hearing on House Bill 1318, renewing the committee to study non-pharmacological treatment options for patients with chronic pain. And I will tell you, Dr. Nagel, we have 72 people signed in support, nobody opposed, and there's nobody speaking in opposition, so hopefully you can use that as you make your remarks. No.
So you got lunch and you got exec.
Thank you, Mr. Chairman. Thank you, members of the committee. You just made my job dramatically easier.
That's what I was hoping I would do, so.
I'm just going to tell you where we are right now because this is the third time I've presented this group before you. We were trying to create something that has never existed anywhere in this country. We're being followed all over the country for what we're doing. What we're doing is listed in the testimony I gave you. I also gave you last year's report where we are. So Senator Chanley was so smart when we started and said this is going to take a lot longer than you think. I said, no, I think you're right. So we spent the entire first year exploring the whole landscape of how do you create a community-based integrative pain care practice. And the best thing that came out of that is we found a place to do it. We did create an ad hoc group to actually create the pilot program. We are now working on, we know what we want to study, which unfortunately is just back pain. We know who we want to have involved. The reason why we did it at a federally qualified health center is they already have the integrative services on site. They have the ability to do data collection. They have the ability to file grants. The only problem is we're doing it up at Ammonoosuc and they're in a rural environment. We are going to add an urban component to as well that we think we have access to now. So we're getting someplace. We're pretty excited by where we're at. I was really worried that Ammonoosuc was going to pull out because of a variety of reasons, not the least of which are financial issues, but they are more interested than ever in this. So that's exciting. And I think that's pretty much where we're at right now. I'd be happy to take any questions.
Are there any questions of the committee? So you're going to complete your work by 2027?
The work will not be completed. This is what I think. I forgot to tell you. So we did create an ad hoc group to actually create the pilot because this group was not going to do the pilot. I'm a healthcare provider, but we ourselves are not. The ad hoc group will take this on. I'm struggling with whether or not this committee that we've created needs to exist after this year. I did pose that after this, what I'm asking for. What I did pose this to that group, and I also posed it to the ad hoc group. The ad hoc group consists of Gary Merchant and Ed Chinchilla. Ed runs the Ammonoosuc facility. Gary and I were the starters of this project. I asked them, do we still need this committee at all? And both voted unanimously that we do. So I think this will probably be the last time I ask for this. But as far as the pilot program is concerned, that's probably a 5-year project.
Okay, and the reason I ask is because I know you've been back every year.
Mm-hmm.
Do we need to, instead of 2027, move it to 2028 to give you a little more?
I would love it if you did. Senator Birdsall, you were the one who wisely suggested we asked for an extra year last time, and I think you, Senator Rochford, Mr. Chairman, are wisely asking again, and that if you would do that, I will say the same thing I said 2 years ago. That would be awesome.
Be one less bill we have to deal with next.
I know that if you want to make it for 5 years, I'd be happy.
Now you're pushing it.
So committee amendment of making it, changing the date?
Yeah. Any other questions of Dr. Nagel, Representative Nagel? All right, thank you very much. Representative Lucas, I've got you on. If you want to just concur with what Dr. Nagel says, we can do that, or you can testify.
Thank you. In concurrence, I would just like to share that in my OBGYN practice, we had a similar pilot program that explored the use of physical therapy to treat chronic pelvic pain. We dealt with different types of pain, and acute pain was usually treated with a short course of narcotics and sometimes combined with acetaminophen following surgery or childbirth. But chronic pain was generally the result of a history of endometriosis, cancer, pelvic floor injury.
I'm going to refocus you. The bill is just extending the date of the commission. So if you could stay on topic, that would be great.
In that case, I think there's a great need, covering a wide span of concerns with regard to chronic pain, and that New Hampshire would be very fortunate to have this program continue. Thank you.
Great, thank you very much. Anyone else like to speak on, what are we on? House Bill 1318. I'm going to close the hearing.
You want a motion to move into exec?
No.
We got one more.
Oh, you do? Oh, yeah.
I'm going to open the hearing on,
My wife wants to know what you just did to shut me up.
open the hearing. Open the hearing on House Bill 1685, Commission to Study the Aiding the Growth of Assistive Technology Business and Adoption of Assistive Technologies in New Hampshire. So Representative Howard, I don't see him in the audience, but so I will,
Want me to introduce it?
sure. Do we want to do it? Can we do it from here? I'll let you go do it. I know you'll be,
Kevin, you can just do it from there.
I can?
Yeah.
Thank you. Well, for the record, I'm Senator Kevin Aver, District 12.
Wait. Let it sit and then it gets settled.
Just let me know when it's time to go. You ready? All right, I'm Senator Kevin Aver from District 12, presenting HB 1685. This bill basically is an establishing a commission to study aiding the growth of assisted technology businesses and adoption of assistive technologies in New Hampshire. Seeing how the sponsor is not here, and basically that's it.
all right, very good. And I've got Vanessa Blaze that would like to speak.
Thank you, Mr. Chair, members of the committee. I will be as brief as possible to get you all out of here. My name is Vanessa Blaze, and I serve as the Director of Policy and Planning for the New Hampshire Council on Developmental Disabilities. And I'm here on behalf of the DD Council membership. We are in support of this bill. The desire for this bill came out of our interest in becoming determined a tech-first state here in New Hampshire. And there are many states in the country who have developed this framework to be suitable to their state and the needs of their state. And we, in the disability community, believe that exploring options and giving opportunities for people to use technology as a way to solve some of the problems that they're facing with some of the barriers that are occurring, especially around the workforce. So I did provide some information on what Tech First Framework is, and I provided some resources, and the DD Council is always here as a resource for you for any questions that you have around the framework itself. I did want to, there's one concern with the makeup of the commission. The Assistive Technology Act is an act that awards all of the states and territories funding to improve access to assistive technology. And here in New Hampshire, the organization that implements that act is called AT in NH, and that is out of the university. And we are concerned that they are not named as a representative on the commission. We believe that their umbrella knowledge and
What
also,
was that? What was that group again?
so that is AT in NH,
AT as in Appalachian Trail.
as in assistive technology.
All right.
Yep,
Assistive technology.
in NH. And that's the state's Assistive Technology Act program.
And it's assistive, IVE
Yes,
technology. Okay.
yes, that's right.
In NH.
And we can connect you with the director of that program if you're interested in talking to them about why we believe that they would be a benefit to be on the commission.
Great. Thank you very much. Any questions for Vanessa? Seeing none, thank you very much.
Thank you.
Representative Howard, we are dealing with your bill right now. Do you want to speak to it? All right.
So we need to add something to this? I'm sorry.
This morning still.
Very good. I just want to let you know, you are standing between us and lunch. Right?
Yes, of course. All right. Well, I'll get started real quick. My name is State Representative Heath Howard. I represent the communities of Stratford and Barrington, Stratford District 4. And I'm here today speaking in favor of House Bill 1685, a piece of legislation that seeks to establish a commission dedicated to the growth and adoption of assistive technologies here in New Hampshire. This bill represents a proactive step toward ensuring that our state remains a leader in innovation while providing essential support for our residents with disabilities. Currently, New Hampshire is just one of 10 states in the nation with 0 technology-first benchmarks. While states like Ohio, Tennessee, and Minnesota have already established task forces and initiatives to prioritize technology as a primary support option, New Hampshire has yet to formalize that framework. Technology first is more than just a phrase. It is a framework that ensures that technology is considered first in discussions of support options to promote meaningful participation, social inclusion, and self-determination for individuals and their families. HB 1685 addresses this gap by creating a diverse commission that brings together all relevant stakeholders, users and parents, state agencies, economic leaders, and nonprofit organizations. We also have identified certain implementation benchmarks to help residents, or they'll seek to identify implementation benchmarks to help residents in need access life-changing technologies. They're going to help develop measures to attract assistive technology businesses to our state, fostering economic growth and in the high-tech sector area. And by supporting HB 1685, we are not just creating a study group, we are building a foundation for future cross-agency collaborations and remote support initiatives that will improve the quality of life for thousands of Granite Staters. Similar legislation has already passed and seen strong bipartisan support in other states, and it's time for New Hampshire to join them. I urge the committee to vote ought to pass on this bill and ensure a more inclusive and thoughtful state moving forward. Thank you, and I'm open to any questions.
Thank you, Representative. Are there any questions for Representative Howard? Senator Birdsell?
Thank you for taking, I just, it was recommended that we add one more person, or one more representative from, it was the Assistive Technology, ATNH.
Yes.
Okay.
Yeah, I would be completely happy with that change. And, you know, again, it's making sure that we have all the stakeholders together.
Thank you.
All right, thank you.
Great. Any other questions for the representative? Is anyone else that would like to speak on HB 1685? With that, I'm going to close the hearing.
And
Do you want to go into executive session?
knock it off on the last two.
All right, so
Motion to move into exec.
second. Make sure Sophie's ready.
Suzanne has a good idea on that.
All in favor?
Wait a minute.
Only we can do that.
I know, now you know how I feel, Sophie.
Take your time.
All right, so there's a motion and a second to go into executive session. All those in favor say aye.
Aye.
Opposed? Let's take up first 13.
Wait.
All right.
Wait, should we be going into exec and passing House bills because they told us not to?
They did?
Because they don't want them on next week's calendar.
Oh,
Just House
just
Senate
for
bills.
the,
So let's talk about it.
let's talk about it.
Okay.
So this last one, we're just gonna make an amendment to. Can we do that, or do we not do that?
We can do a committee amendment and then pass it next week.
Maybe not.
Then we've got to make a motion to pass it.
Right, yeah, because you can't talk about it until, yeah. So we're gonna do that.
Yeah, let's then, and that's a good point because we are swamped next week and we've got plenty of time, but I don't think there's a lot of, I think we're all kind of aligned based on some of the questions I've heard. I think we are on some of these things, so we can talk about them next week and get them out. So I'll take a motion to go out of exec session.
So moved.
Then we get a second from Senator Prentice. All those in favor say aye.
Aye.
Opposed? No.